This is sort of the hub of what we call the inpatient area of the hospital. So if your pet is admitted out the back, we'll always call it, this is the room that they're always going to come to first. Patients in here are anaesthetised and prepared for surgery, have procedures done like IV catheters placed and blood samples taken, wounds dressed, that sort of thing. Feeding off this, we've got 3 different theatres. 2 of them are what we call our clean theatres. Then we've got our dental theatre, which keeps the bacteria that are created with dentistry in its own little space, looking after patients who have both routine surgery, like spays and neuters, but also patients who need cancer surgery or orthopaedic operations, so lots of different dogs and cats. Occasionally we will get some of the Arana Park animals, a native gecko under anaesthesia, spider monkeys, and we were lucky enough a few years ago to be involved in the initial rearing of litters of cheetah cubs too, which was very cool. We're very lucky. Huge focus on managing pain. Any patients who have medical or post-operative pain are monitored really very carefully, and additional pain relief provided whenever they need it. Vets who work out here have done extra study, and the nurses too, in the areas that we work in. From the medical side, they're receiving the best we can offer. Very, very lucky to have it purpose-built and built really nice and big, so we've got plenty of space. Plenty of modern features, things like having positive pressures in our operating theatres. That's something that's done in human operating theatres. We make sure all of that high standard's been incorporated into the building design, and it works really well for us. New Zealand Veterinary Association, of which we're members, runs a voluntary accreditation scheme for vet clinics. It has several levels. There's what's called a clinic accreditation, and then the next level up, which is hospital accreditation. Hospital level is the highest level of accreditation, and we were the 4th practice in New Zealand to achieve that. We were all absolutely rapt when we managed to get there. Clinics who are accredited get re-inspected every 2 years with a day-long audit. The types of equipment we have and what our procedures are for things like preventing the spread of infection or making sure pain is adequately managed. It was a really big undertaking, but we're super proud of it, and we feel like it's made a really big difference to our hospital. Why I like working with animals is a hard question. I started wanting to be a vet when I was 7, so I can't really remember. 20 years as a vet this year, and I have in no way become even slightly bored of it. Every day is different. I just love the ethos of it, that we're constantly doing better and better, and can't imagine doing anything else.